And welcome back to the Morning Blend. Class is in session. It's Insurance 101 with Sovereign Select. And today we're going to tell you about special circumstances that might make you eligible to change your Medicare plan right now before the enrollment period. Tom Qualley is the CEO of Sovereign Select, an independent insurance agency that prides itself on saving you money. Right?
That's right.
You've been doing this and here on the show about 7 years, I feel like. And some of the stories you have about saving people money are quite incredible.
Yeah. I mean, it happens regularly where we're able to help people that are on Medicare, because we're an independent insurance agency that specializes in Medicare. So we have access to dozens and dozens of insurance companies' products that can help people save money. So really, based on people's needs, we can assess what their actual needs are and then really custom fit them with a program that's going to work for them and ultimately save them money.
It's incredible. We want to talk about the special enrollment period, also called SEPs, right? SEPs. There are special times during the year outside of the annual open enrollment, because that's always a very specific time that you have open enrollment.
October 15th to December 7th.
So people on Medicare during these special times outside of that normal enrollment period can make changes to their Advantage or their Part D prescription drug plans, right?
So there's certain times throughout the year that things may happen in a person's life. There's certain changes might happen that would allow them to change their Medicare plan outside of that annual open enrollment period, which is again October 15th to December 7th. And these timeframes could be a person's maybe working past age 65 and receiving employer group coverage, and when they retire, maybe they're losing that employer group coverage.
Okay.
We're also finding that we beat about 80% of group insurance plans when a person is on Medicare.
Wow.
So for the most part, 8 out of 10 people are making the wrong choice if they stay on their employer's plan after age 65 when they're eligible for Medicare. So that's something that people should definitely be proactive about. Also, some people may qualify for Medicaid, which is help for people with low income and assets to help pay for medical costs. Also, people may be disqualified for Medicaid. Maybe they were on it and now they don't qualify for it anymore because of their income and assets. So that would also allow them to change their plan.
It's important for people to probably ask questions and be like, hey, there's a change in this circumstance.
Absolutely.
Could I possibly be eligible?
Yeah. One big one is change in residence. So if a person moves, these plans are all based on area that a person lives. So when a person moves, they might either be required to change their plan or be able to change their plan, and it might be beneficial to them. So it's really important to just be in touch with Sovereign Select, ask questions, say, hey, this is changing in my life. Does this matter?
See, and I think education is so much a part of what you do. You do those meetings the last Friday of every month.
Yes.
The purpose, the intended purpose is that they would be educational, that people can ask questions.
Absolutely.
And you do these at no cost for people to get their questions answered.
Right. So these classes called the Road to Medicare. So these are really designed specifically for people that are on the road to Medicare. So they're facing a big change in their life, which is transitioning to Medicare. So one of the biggest things in talking with many people over the years that have made this transition to Medicare ahead of time, there's a lot of anxiety and nervousness about changing into Medicare, not knowing exactly what to do. My employer's taking care of me for so long, now I have to go transition to Medicare and figure it out on my own. So that's why we offer these educational sessions, which is really just designed to help people understand what Medicare is, how it works, what their transition is going to look like. We even give them a little bit of homework, not required, but some homework as far as how what steps to take to actually transition smoothly into Medicare. But it's all educational. There's no sales there. There's no products. It's just all about Medicare and all about that consumer.
It's wonderful. So you do that at your office. I know you're also willing to do one-on-one, no-cost consultations. You'll also go to people, evenings included. You want to make it flexible to work with people's schedule, but you'll see them or have them to the office and do a no-cost consultation. They can also visit you online and learn more too, right?
Yes, we're absolutely flexible with meeting people, whether it's in our office, in a central location, at their home. wherever.
All those good things. Okay, so again, the last Friday of each month is the Road to Medicare. These are the educational meetings. You hold those at 10 a.m. and 2 p.m. People should call to reserve a spot at one of the meetings.
Yes.
The phone number is 262-641-4111. You can go to savselect.com/calendar to find out about the next meeting and to reserve your spot. Again, you also offer no-cost consultations at your office, which is located on North 124th Street in Brookfield, or you'll come to people's homes or wherever they'd like to meet you to share with them details about what they can do about their insurance coverage. There's the phone number again on your screen. savselect.com is the website to visit for more information as well. Great to see you.
Thank you.
Thanks
Nice
so
to see you
much,
too.
Tom.